Hello, my name is Dr. James Case and I'm the Chief Scientific Officer at Cardiovascular Imaging Technology. This tutorial is designed to give you an understanding of how to use the tools within Imagen Pro to assess the image quality of myocardial perfusion PET studies. The term image quality broadly describes certain aspects of an image that describe the information content. These characteristics can be broken down into spatial resolution, contrast resolution, image noise, and image artifacts. The spatial resolution of an image describes the spatial details of an image that can be distinguished. This can be affected by the instrumentation, the acquisition, the reconstruction type and its parameters, and the noise filtering. Measuring the resolution can be done by counting the number of line pairs per unit distance that can be resolved. In this illustration, this image is displayed with decreasing amounts of filtering. As filtering is decreased, smaller details such as the RV and papillary muscles are more easily visualized. Contrast resolution is different than spatial resolution. Contrast resolution describes the ability to differentiate features from the background. Displayed are two different 3D images, each acquired from an LSO dedicated PET system acquiring in 3D mode. The top row is processed on a non-CVIT workstation. In that image, uncorrected scatter in the image reduces the dynamic range of the shades of gray. This limits the range of the shades that are available for identifying actual perfusion defects. In the lower image sets processed using Imagen 3D, differences between the background and features are greater. This higher contrast resolution provides greater dynamic range for identifying the features of the image. Image noise describes the random variations in an image. We can measure this noise in terms of signaled noise in the case of raw data, or as the mean value to the RMS variations in the reconstructed images. Displayed is an image with a significant amount of image noise. This image noise acts to hide true defects and introduce variability that also can be misidentified as real defects. This can have an impact on both the sensitivity and specificity of these images. One potential strategy in reducing the impact of image noise is to increase the amount of image filtering. This has the effect of reducing the influence of image noise at the expense of spatial resolution. Image artifacts are features in the image that are not present on the actual objects. Some examples of these in PET are misregistration, which is the misalignment of the emission and transmission data to one another, intrascan motion, which is any motion that is confined to the emission data set, transmission artifacts, and any camera defects. During the reconstruction, the technologist should review the rotating projection datasets for any camera defects, non-cardiac uptake, etc., remembering in PET that patient motion cannot be assessed by reviewing the rotating images. We then select a good coronal view for misregistration correction. The lower slider is used to correct for any misregistration. We're going to use this function to create a fictitious image artifact. In PET, the transmission and emission datasets are acquired at different times. Because of this, if there is motion between the two scans, the transmission study cannot be used for attenuation correction. The misregistration correction tool within Imagen Pro is used to compensate for this motion. Misregistration artifacts can introduce fictitious reductions in tracer uptake. This is most commonly apparent in the lateral wall, however it can be present in any wall. These defects can have a significant impact on the accuracy of image interpretation. For this reason, no study should be processed without first carefully assessing the registration between the emission and transmission datasets. Proper alignment of the emission and transmission datasets can be performed using other anatomical features as a guide, such as the lungs, liver, and diaphragm. Some patient motion is not correctable, such as when a patient falls asleep or talks through the acquisition. When proper alignment is obtained, attenuation correction can be applied with great accuracy. And the final image data set is a good representation of the actual perfusion uptake. Reviewing the image quality of an image begins by first assessing the functioning of the camera. Second, we assess the counts from the emission data. Then we assess the transmission counts, followed by assessing if there is any patient motion. And then finally, we assess the registration between the transmission and emission data. When there are QC problems, we need to determine their severity before proceeding to the interpretation. We will use the ImageNMD quality review environment for assessing this study's image quality. First, we will inspect this image for any camera defects, such as a bad block or bad normalizations. We will then select a coronal view. Next, we can assess the emission counts. On the far left column, there are quantitative QC assessments that can be helpful in making these decisions. First, we inspect the signal-to-noise and the raw rotating images. We also look at the noise in the reconstructed images. Following that, we can inspect the transmission data. A high-quality transmission data set should have smooth counts in the mediastinum as well as well-defined lung boundaries. It should be uniform and have no transmission pixels that are deviant from the soft tissue or the lung values. Images should also be inspected for motion in the emission data, also known as intrascan motion. This can be done either quantitatively or by comparing the differences in resolution between the coronal and transaxial views. Finally, datasets can be inspected for registration between the transmission and emission datasets. The heart should be out of the lung field and fit tightly into the transmission image of the mediastinum. Once the study has been determined to be of high quality, we can proceed with the interpretation. A good quality PET perfusion study, absent of any perfusion defects, should appear uniform throughout the entire myocardium. The only remaining fluctuations should be from partial volume artifacts at the apex, the papillary muscles, and at the intersection between the LV and the RV. Gated studies at both rest and stress should have a smooth cine appearance throughout the entire gated sequence without flashing or drops in counts. It also is good to look at gated studies in both a color scale and in the gray scale. In summary, image quality is a combination of the spatial resolution in the image, the contrast resolution in the image noise, and the presence or absence of any imaging artifacts. A detailed review of the image quality, both visually and quantitative, is necessary prior to the image interpretation. Thank you for watching this tutorial, and please subscribe to this channel below.